one thing that we realized is that we have to have a bottom-up approach. It cannot be a top-down approach, starting with technology. We all look at technology a certain way, but how do people at the bottom of the pyramid look at technology? And we've learned a lot by doing it bottom-up. I think we have realized what really are the pain points for the poor patient. We realize what the pain points are there for the average citizen, and we've started looking at how to basically fix some of these areas. So, for example, we know that the biggest pain point that a poor patient in a village has is absolutely zero access to any decent health care. And we know how under-resourced our primary health centers are. So by using technology, the first thing we have to do is to make sure that the person in the primary health center has an understanding of technology, is trained, and how do we make sure that the ASHA workers are also sufficiently trained to use technology for the kinds of things that we are trying to use health workers to do. I think the pandemic was a big eye-opener. I think we had a very successful rollout of immunization, pandemic awareness, testing. I think that actually helped us to formulate and form many of these new thoughts and processes and thinking around what makes sense in terms of technology, in terms of delivery, and in terms of making sure that we actually provide health equity to the poorest of poor. I think we have done a very good job. If you look at our primary health centers, and I know that many of our primary health centers were absolutely brilliant when it came to testing, vaccination, and creating COVID awareness. And I think to have this kind of a reach and a network in a country as large as ours, I think is extremely, extremely commendable. So I think basically we are a country that is in a state of preparedness. You can see that even in recent times, when you're seeing a little increase in COVID cases, there is a constant surveillance across the country that is leading to this. So I think what the pandemic has also taught us is surveillance and rapid response to any trends that we are seeing, which we need to be, alert about. So I think we are very prepared. I think what we have done during the pandemic is enormous, and I think we've reaped a huge number of benefits thanks to the kind of policies, the kind of efforts, and the huge network that we created during the pandemic, where health workers, whether it was ASHA workers, whether it was nurses, whether it was doctors, whether it was paramedics, whether it was others associated with the healthcare system, I think that network was tremendous. I think, our whole TB program is also something that is worth talking about. I think we've done a lot to, the DOT program has been a very, very successful program for compliance. And I think TB also is an area which obviously is a huge disease burden for a country like ours. But more than anything else, I think access to potable water, making sure that our sanitation is improved. It's a journey, but at least we've started in this area, which is going to make a big difference to infectious diseases. Of course, in terms of other diseases like cancer, I think there's been a huge effort in terms of oral cancers. I know that I myself have been involved with a very large effort in detecting and diagnosing early and late stage oral cancers. And I think that oral cancer screening program that we've all embarked on is extremely, extremely important for a country like ours, where some of our habits of betel nut chewing and smoking is getting us into trouble. And I think building awareness around that also has helped a great deal. So I think, when you look at some of the pivotal moments, certainly I think HIV was a pivotal moment, not just for India, but for the world. I think malaria and TB are very strong focuses for India. Of course, the fact that immunization has been at the heart of many of the infectious diseases and communicable diseases like polio and, of course, now the pandemic has also helped us to basically, take the lead in terms of large-scale immunization, which I don't think any country in the world has to do as India has to. I mean, it's very obvious that we have a huge human resource deficit. We have a shortage of 1 million doctors, 1 million nurses, and several million, sort of other technicians and paramedics in the country. So it's very, very challenging for a country like ours to really kind of bridge this gap. I think a lot of, discussions and policy discussions have been entered into by saying, how do we just free up the medical ecosystem? How do we get more medical seats? How do we get more postgraduate medical seats to get specialists? How do we basically train nurse practitioners? Because nurses can do a lot more than what they're doing today. We actually graduate 50,000 MBBS doctors every year, but they are their knowledge is very basic, just maybe a tad higher than what a senior nurse is trained to do. But can we not really give them an additional specialized course to make them specialist doctors, like diabetologists or oncologists or neurologists? I mean, these are things that we do need to do very rapidly instead of getting very bogged down with do's and don'ts of a very set in cement kind of curriculums of the past. And I think technology, of course, has a huge role to play. So I think there are two things that I would really suggest, and one is that we embed the use of technology, especially now that you've got AI like ChatGPT in decision making and diagnosis. That should be taught as and made a part of our medical curriculum. And the third is quality of care. I think we really need to focus on quality of care. And I think when I talk about quality of care, it starts with standard of care, but it also, is about ensuring that any hospital or clinic that is delivering healthcare has a high level of quality. We know that one of the biggest challenges we face in the healthcare system is hospital-borne infections. How do we make sure that the patient is not subject to that?